All right, good morning, everyone. Thanks for taking a moment to join me this morning to review medical billing as well as client bill and fee-for-service. So I hope this training is informative as well as at least will bring one element of this process to you that you didn't know before. So I think it's important to understand a process. So the biggest thing is that it doesn't affect your commission to know how medical billing works. So definitely wanted to go over those, the entire process with you. The one thing about medical billing is it's not just for Castle, it's for all providers in the United States as far as I know, and possibly other countries. But this is how a medical provider gets paid, and that's where I wanted to share all the elements of it. So here, medical billing, understanding the elements of getting paid. So let's move on. What is medical billing? Medical billing is the process of submitting and following up on claims to insurance companies, patients, or the United States government in order to receive payment for services rendered by a medical doctor or other licensed healthcare providers. So how does that work? So let's break it down. It all starts, as I'm sure all of you know, with our requisition that is sent to the practices to fill out. We have the requesting referring provider in the top left-hand corner. That you're going to see here in a moment is on our HCFA form. HCFA form is what is actually sent to the insurance company electronically or on paper, and that tells them who's ordering the test. That is the information that's on the our requisition. That's why it's so important that that's there and marked, to be honest, so that we know the proper provider is, this is who is actually ordering this test. We need the patient details, first name, last name, the sex, the address. That is all required on that claim to be sent to the insurance company. Especially if they're a self-pay patient, we need that to be able to send them a bill. I'm going to move over to the left, to the right. ICD-10 code. We need that. That describes the condition of the patient. What is their symptoms, their reason for their ailment, basically. That is very important to have that, because that code also has to relate directly to the procedure that is being done for this particular patient. So as an example, you wouldn't have a hypertension code up there when you are performing an ear wax removal. It does, those two things don't go together. So the ICD-10 code needs to match what is the procedure, the CPT code. So who is billing it? That needs to be marked on the requisition for us to know who's doing what. I'm going to go into that farther on down and touch upon that again, but having one of those selected tells Castle what we're doing. If it's marked insurance, that means Castle is billing the patient's insurance. Self-pay reflects that Castle is billing the patient. And client bill is that we are billing the client, that they have that pre-arrangement for that we're going to be billing, sending them an invoice. And also the insurance details, that's what that's representing, is that you can actually list on here the insurance company that they hold, the member ID, the group ID, that all can be listed here. We would prefer the insurance card itself, a copy of it, front and back, to allow for better understanding of the insurance that that patient holds. For instance, they could write here Blue Cross Blue Shield of Georgia. However, there's multiple locations in the state of Georgia where that claim might need to go depending upon the plan they hold. So I'll get again into that in just a moment. The procedure, that's actually them marking the test that they are ordering. All depends on what they mark there is what type of procedure codes needs to be billed. So that's very important that we know exactly what they are wanting us to test for. So it's not just about getting the proper results to them, but it's all about billing as well to give them, to have us submit to the insurance company the proper procedure for billing for that patient. So on down, we know we have on the requisition the current medications, but we do not need that for billing. Same thing with point of care, we do not need that for billing. Those are our prime elements that we need. We take that and we enter it into our EMR system, which is our Comtron, for us to be able to bill that procedure out for that patient. Once we enter that into the system, we will then generate a HCFA. This is exactly what a HCFA paper document looks like. So we need the patient details, the insurance, full information, the claim information. Here I'm reflecting that if it's a workman's comp or if it's an auto or other incident or accident, we need those details. A workman's comp requires date of injury. Same thing with an auto accident. They require a date of injury for us to submit under that claim. So those details are very important to send to CASEL so we understand how to bill that claim out. On down, referring provider information. Again, that's who's ordering that test. Diagnosis code. We require an ICD-10. ICD-10 started in October 1st, 2015. We switched from 9s to 10s, and I'm going to talk about that in a little bit. But it's very important that we have the proper ICD-10 code to bill out the claim. The date of service, to and from. Normally, all of our claims primarily is just going to have the same date will be in both locations, to and from, because it's not a hospital visit or anything like that. We're talking about just a single date of service that we've collected the specimen and we're billing out for that specimen to be tested. But this same type of form would be used for a hospital, and it could be reflecting a stay in the hospital. I might be admitted into the hospital on a Thursday and released on a Saturday. That would be your to and from date. So it's important to have that proper information on the HCFA form. Procedure code, that is what is being done for this visit or for this patient, this procedure. Those come in two forms, CPT code, which is primary for commercial coding, or a HCPCS code, which is primary for government coding. So I know that I've talked previously about the Medicare fee schedule. Many of those actually are HCPCS codes, but primarily HCPCS are G codes. But CPT codes normally are 8 codes. So I know I'm going to show that with you, share with that as well, that you're going to have 8 codes, which are the CPT codes, and G codes, which are HCPCS. You also need the billing provider details. For us, that would be Castle Medical, and also the signature of the physician. For us, again, that is our entities here at Castle Medical. We have that listed there on the HCFA form. If in reference to a provider who's in your office, if they are billing, their information will be down there. They are the billing provider, would be on the HCFA on the HCFA form. The signature of the physician would be on there, not us. So it's important to have all those details in the proper locations. Everything has a particular box on the HCPCS form, and submit that. This, again, is sent electronically or via paper. Over the last few years, they've really pulled back from paper being accepted at all. They are all going through an electronic submission, which is called a clearinghouse, to be able to be submitted, to submit that electronic form. And it does not go over like this, how you're seeing it here. It goes over through an electronic format that pulls into their system on the payer side for them to review and process that claim. Moving forward, I want to go ahead and talk about United States government insurances and commercial. This is where it's really important to understand how to read a patient's insurance card and just to know things that you're looking for. So I'm not training on that today on how to review those insurance cards, but just know here, looking at this, you have, like I've mentioned here, I have some primary logos of insurances that are government insured. You have your primary Medicare and Medicaid right at the top. But then you have extended into insurance companies. They have their own Medicare, Medicaid plan options. For instance, you have United Healthcare, Cigna, Aetna, Blue Cross Blue Shield. They look very similar to the commercial, and they will. The cards will look almost identical. That's where it's important that the collector, especially if they're a client bill or fee, well, primarily client bill, that they're going to know how to read that patient's insurance and understand what they're marking on that requisition. Insurance is a big understanding that they have to have strong knowledge of for a good, strong client bill client to exist. It's very easy for them to look at a Medicare United Healthcare card and they'll mark it commercial for them to bill, and that would be incorrect. So, but just as an example, here's just some of those logos to reflect the differences. But again, it's just really important that everyone understands how to read those insurance cards. Moving on, a little bit more information regarding the diagnosis code, ICD-10. Again, these went into effect October 1st, 2015. And just wanted to reflect the difference of an ICD-9 and ICD-10. So here we have the basic format of an ICD-9, which is primarily, it was just a 5-digit that just reflected the category and the cause and location. It is now expanded into a category, cause, location, severity, and extension of that condition. When this went into effect in October 1st, 2015, they went from 13,000 codes to 68,000 codes. So you can imagine the complexity of that transition, that understanding of what do they need to select for that patient for that particular code. It began and created quite a educational hurdle for all providers to actually go under during that for that period of time. I'm pretty sure they probably have it under control at this point, but it took them definitely a while to get used to transitioning from ICD-9 to ICD-10. I've actually shown here, this is actually from our welcome manual, a reflection of just some pain management codes. On the left is ICD-9, on the right ICD-10, and you can see they're not always a single code to a single code. That is the reason that they actually transition from ICD-9 to ICD-10, is to give more detail in that single code so it can be more understood of what the condition that patient holds. So they actually added so many additional codes that there's now one that you've been injured from a plane that you possibly flew out of the passenger window or something like that. So they've created all these scenarios of incidences that might need to be coded for a medical condition, and they are now in the ICD-10 book. So, but again, it's very important for them to know their codes and to give us the correct one, especially if we're billing it, so we can bill it appropriately into the best possibility of reimbursement. Regarding ICD-10, regarding CPTs and HCPCS, I just wanted to show a reflection here of which one to bill. This is again another situation where the provider, if they are a client bill, they might not know which codes to use, and this is where it does get confusing, and the insurance companies like it to be confusing. So let's just look at this for a quick moment. We have our comprehensive panel CPT codes on the left-hand side. All of those are reflecting the drugs that we are testing in our comprehensive panel, and these are the 8 codes, what we consider CPT codes. But if an insurance company wants the HCPCS, it's a single code, G0483, that reflects all those codes in a single code, which is a lot easier to bill. However, back in 2015, when they introduced, I believe it was 2015, they could have been actually 2016, the year has expanded, that at the beginning of that G-code change, that many insurances hadn't decided which codes they actually wanted to utilize. We were still, let's say as an example, United Healthcare, a commercial plan, was still wanting the CPT codes, all of those to be submitted for a comprehensive panel. But in mid-year, they changed it to just want the single G code. And so then claims started being denied because they submitted 8 codes. And a lot of clients, as well as us here at Castle, was wondering, okay, what are they wanting? The best thing in that type of process is to call the insurance, and then they will share, we are now accepting the G code for this type of testing. and then you resubmit it with the proper code, and normally it'll get paid as long as the patient has proper coverage. So it's really important, again, and I'll talk about that in a quick second, about follow-up. Following up on that claim is extremely important. So they're going to know why the possible insurance denied the claim and what actions need to be taken on that biller's side. So here, follow-up on the claim. Why is follow-up so important? Not all claims are approved for payment, but denied due to a specific rule set by the insurance company. The denial reason must be identified and appropriate steps taken to adjust the claim for reprocessing. So that is where the longest period of time takes, is if the insurance company changes rules, that as the billing company or the biller themselves need to reach out to the insurance company, find out why it was denied, and make adjustments if they can to get it paid. There is some instances of denial that can't be adjusted and payment is just not permitted. But that follow-up is so important that everyone stays on the same page of information to be able to hopefully better benefit the practices, moving them forward for reimbursement for all future claims that would reflect the same type of billing. So again, the insurance companies, they have their own set of rules that they follow, and it's our responsibility to, as medical providers, to reach out to them and obtain what they're doing so that we can follow suit and make sure that we can get our maximum reimbursement. Moving on, a process claim. How does it reflect? Here is an example of an explanation of benefits. So I just wanted to take a moment and review this and talk about just a couple things that it's reflecting. First of all, how to read an EOB. That's what we're going to start at. Normally it starts out with the insurance information at the top, the patient's information at the top, customer service information. But then on down in the graph is where you get into more detail about what service was rendered for that patient. So down below, if you can notice, it says date of service. This would be that to and from date. That was just like on the HCPCS form, the HCFA form, what the service was. Service code, this would actually be the CPT code that was billed. That's what's going to be listed there. So you can only imagine if we had to bill out all of those CPT codes, they're all going to be listed here on an explanation of benefits for a patient. This is when we would get, for Castle as an example, they would see their EOB, they would see those codes, and actually normally there's an explanation next to them of what that code is. And we would get many angry calls that says, I do not take cocaine, I do not take opiates, why did you bill me for this? So that's where it gets into understanding of what an EOB is and what is being done for those patients. So next to the service code, we have the total amount. This is the total amount that was billed to the insurance company. It's important to know that. So we're going to stay on that first line where it says $50. Next to that, it says not covered, $0. So they're basically saying that the entire plan, if you move over to the column that says covered by plan, $50 is the covered for this plan. So this patient, for this particular code line, the entire thing is covered. They're saying 0 is not covered, but for the full plan, $50 is covered. The issue is to the right of that, it says deductible amount, $50. They've applied that full covered amount to the patient as their deductible. On down the middle line where it's $400 has been charged out, $336 was non-covered by the plan. The $64 that was covered, again, if you looked under covered by plan, $64 was covered, but however, they applied it to the deductible. And the third line, $100 was submitted to the charge, $24.55 was not covered. The covered plan for that charge was $75.45, and again, they applied it to the deductible. So the actual EOB themselves that Castle would, again, Castle receives the EOBs as well. There was no check, so no payment was given to Castle in this, if this was a Castle EOB, but that the deductible amount, $189.45, needs to be collected by the patient. And this would be the same thing at any practice, that if they're billing out procedures, just an office visit, if it's applied, if it is covered by the plan, but applied to the deductible, by law, that provider should be billing the patient for the patient responsible amount. You can also have balances in copay amount. So there's normally a co-insurance if they have a secondary that is actually being forwarded on to the secondary insurance. But this patient here doesn't have co-insurance. They don't have a secondary insurance. So again, it's a covered charge. Absolutely, those 3 tests here that was billed to the insurance are covered by the patient's plan, but they have been assigned to the patient's deductible, and that's where the payment needs to come from the patient. I definitely want to discuss here under not covered. This is the section that, again, we talk about balance billing. So let's just read the box of how they've indicated here. Oh, my apologies. There we go. My cord got in the way. Charge is not eligible, which could be a discount written off by the provider or a charge the patient is responsible to pay. This is the section on an EOB that some providers who are not in network can bill a patient. It's called balance billing. They are balanced, whatever the difference between the covered and the charge amount, they are taking that balance and billing it to the patient. Castle Medical does not do that. That's a situation where that a provider can if they are out of network, but we choose not to. So we accept, for instance, what would be under the covered by plan amount. In this case, the $189.45 amount. That is the amount that we will accept as the only collectible amount that would be from the insurance company or from the patient. Again, that non-covered, we do not balance bill that to the patient. Does anyone have any questions about that? Okay, excellent. So moving forward, receiving the payment. Once a claim has been approved, payment can be received from the insurance company, or the insurance company can apply the payment to be paid by the patient through a copay, coinsurance, and/or in and out of network deductible. So again, that payment needs to come from the insurance or the patient. Those are the 2 options that we have if it's an approved claim. Note, some providers that are not credentialed with an insurance company will bill the patient for the non-covered amount along with any other responsible amount. Castle Medical does not do this. This is called balance billing. Again, we do not do that. Patient statements. Statements are sent to a patient when the insurance company applies payment to them, as well as if the patient is self-pay. Again, this isn't one of our statements, but ours will look very similar to this. Again, patient statements at the top with the date, who's it from. Again, it's going to say Castle Medical. For services rendered to, again, the patient's address, their name. This is why it's very important that we have the patient's address so we can actually send them a statement. It's also number 1 required on the HCFL and on the HCFL form to send to the insurance company. So both definitely very important that we have the patient's address and information. Then on the statement, it's going to reflect the dates of service. The transitions is actually, it'll possibly say comprehensive plan. I believe our statements actually outline all the drugs by line, CPT, and what has been applied to them for responsibility, much just like this. So this is a similar reflection of what our statement would look like to the patient. Now, in a nutshell, the medical billing process is important because it means by which the provider and their employees are paid for their services. The process itself, submitting claims, posting payments, billing patients, following up on unpaid accounts, if not done correctly, has many opportunities for a provider to miss reimbursements for their services. So, in a nutshell, it's complicated with many moving parts. To eliminate many of the roadblocks is to receive accurate information from the patient the first time around. That will reflect on sooner payment to you for your commissions, as an example, And so having that proper information is the key to all medical billing, is having everything at the time of collection from the provider when they submit it to Castle Medical. Does anyone have any questions about, in a nutshell, how the process works? No questions. All right. Well then, perfect. Let's go on. We're going to keep moving on this. Let's take it into Castle Medical client bill fee for service. I really felt that it was really important to understand the medical billing end, how it functions, how it flows. Again, not just from Castle as a provider, but from the provider themselves. They have to do those same steps as well. So let's go ahead and let's talk about this as well from the Castle side. If they want to be a client bill client or a fee for service client, how does that work and how does that affect them and what do they need to do? So starting out, let's discuss the terms. What does the terms and definitions mean of who's doing what? Client bill is an arrangement between Castle Medical and the medical provider, where the medical provider sends bills for the laboratory services directly to the patient's insurance company for reimbursement. That means that the medical provider is responsible for paying the predetermined test fee to Castle Medical regardless if the medical provider receives payment for the patient's insurance or not. They're taking responsibility that they're going to say, I'm going to bill that patient's insurance for the reimbursement, and regardless of what that reimbursement is, I'm paying Castle for their service. It's really important. Now, many providers reflect the direct bill is exactly the same, but in true medical terms, direct bill just truly means that the provider is billing the patient's insurance, as it lists here, an arrangement between a health insurance provider and a medical provider where the doctor sends bills for service directly to the patient's health insurance company. This means that the patient does not have to file their own claim for their insurance company. That's a true definition of direct bill. That if a provider was not a direct bill, didn't have even a direct bill option to bill a patient's insurance for the claim, the patient would have to bill their own insurance for that claim. So most providers don't even do that. It's not even an option for most situations, most payers anymore. But there are still some out there that they still require the patient to submit the claim and then pay for their own service at the provider's office. So, but again, it's always really important to make sure, again, it's still the medical provider is billing the patient's insurance, much like client bill, except that just brings the client bill element brings us in, that we're billing the client for them to be billing the patient's insurance. Below that, insurance bill, especially if we're reflecting upon the requisition, that means that Castle Medical will bill the patient's health insurance provider for the test performed. So we are direct billing the patient's insurance, not the client. And patient bill self-pay is, again, Castle Medical will be billing the patient directly for the test performed. Client marks client bill if they want to bill self-pay. That's in the case of fee-for-service. They're going to be marking client bill, so even if the patient's self-pay, if they are fee-for-service, they would be marking client bill, they receive it from the patient, and then pay us. Okay? Any questions about any of those terms? Okay, moving forward. Welcome to client bill fee for service. So again, I know that I'm reading these, but I think it's important to review and reflect on the same type of terms once again. Client bill, a billing program that bills the client for selected tests that the client can bill the patient's commercial insurances to receive reimbursement for the various laboratory tests that are reported here at Castle Medical. And fee-for-service, what that is a billing program that bills the client for selected tests. The client does not bill the patient's insurance plans to receive reimbursement for the various laboratory tests that are reported here at Castle Medical. Clients with direct payment coming from the patient. So major difference there, obviously, is that client bill, they are billing the patient's insurance, In fee-for-service, they are not. They're collecting from the patients themselves. So those are the primaries. There are many states that do not allow the provider to bill a patient's insurance laboratory services. So they cannot collect funds in that manner to possibly create a revenue from that. So the option for those states is, again, that we bill it ourselves. If they have insurance, then we bill it here at Castle Medical. Those would be traditional clients. Fee-for-service, though, would be a good candidate for that, would be have a large self-pay population, that they are collecting funds for their laboratory services from the patient, and then they just then pay us the invoice that we send out every single week. A lot of fee-for-service clients could be rehab centers who a lot of times possibly the insurance is not involved at all. That is just a outright payment from the patient that they're there, rehabs for sure. So then they just possibly during that rehab program they need to be tested possibly every week or more, and that's all part of their lump sum fee of collection from the patient, and they would just pay for the service. Each time a sample sent to us, they would pay us for that testing. Again, that's a perfect, great scenario of fee-for-service. Also, again, if there's a practice that has a large self-pay patient patient pool, then they can actually collect those funds up front from their patients beforehand, and then we send them a bill. They pay us for that. So for fee-for-service, we always display for them testing, what the types of tests that they are agreed upon for fee-for-service, and give them their pricing. They can then pass that same price on to their self-pay patients or mark it up slightly to be able to, again, receive some small profitability, but then pay us on a regular basis. So what we need for a client bill fee-for-service, how to fill out a contract, setting up a client an account, how to fill out a requisition, how to bill or not to bill, invoicing and statements, and commissions and delinquency lists. So let's dive into these items. So what is needed for a client bill? Again, I'm talking about really what's needed from the client's end. First of all, the client who is knowledgeable of their credentialing. So let me get into a credentialing. I haven't talked about that yet on this training. Credentialing is the arrangement between a provider and an insurance payer that states in their credentialing paperwork, their agreement, that what types of tests they can bill a patient's insurance for reimbursement. So as an example, a chiropractor is not going to have the same approved CPT codes or procedures for reimbursement as an ENT. So it's important because they have different roles. They have different responsibilities in their field. So that's where their credentialing comes in to be different. It's not across the board blanket of we will pay you for anything that you do. It definitely comes down to what they are credentialed for, what are they trained to do, that type of thing. So many providers, even though, for instance, in the state of Georgia, any provider, there is not a law that prevents them from billing pathology services. However, are they credentialed to bill pathology services? So that's where they need to go back and look at their payer credentials to know if they can actually do that. If they are not, then they can contact those payers and see about adding them. They do have that option, but they, for number one, need to find out what they currently are. We never want to promise a provider that you're in a state that allows this, so you should just do it. We want them to look at their credentialing to know if they themselves are able to do it. The law will not prevent them, but their credentialing could. A client who has a strong biller, they need to understand, again, insurances. Well, actually, that's on to my next one, but the biller themselves need to just be knowledgeable, especially be a biller who's going to follow up on claims, so on and so forth, that they're going to attempt for their provider to be able to receive the highest reimbursement possible. Because if they're not receiving reimbursement at all, they're not going to like the program, and they're not just going to keep paying us if they're not getting reimbursed. So again, that strong biller is extremely important. Clients who understand the difference in insurance reimbursement rates, that's again a huge one. That again, they understand the insurance and they understand of how it all works. So and again, it comes back down to their credentialing of what is going to be approved and possibly not approved. And also a client that agrees to and understands the client bill agreement, that they are in a complete understanding that if they are marking client bill and they're billing that claim, that they're taking full responsibility for it, that they are going to be paying Castle Medical for that prearranged rate, regardless if they get paid. It's really, really important. But what is needed for fee-for-service? The client just needs to understand that they're going to pay us for our service. The client that agrees to and understands the fee-for-service agreement, that again, they are going to be receiving a bill, they are going to pay Castle for that bill. They don't have to worry about billing it out to an insurance because it's not being billed out at all. So we just need them to be a strong client that will pay their bill on a regular time. Blood and chemistry, client bill, fee-for-service protocol. This is really important that for any client that wishes to bill for blood and chemistry testing, the following steps must be completed. Contact me. That's who you contact with the client's information, the test with CPT codes. The CPT codes are really, really important because if the client, if there's miscommunication regarding that test, then it's very easy for me to possibly give them the wrong pricing. So again, we need a CPT code. As an example, a CBC has 3 different tests. If you just write down they want a price for a CBC, I'm not for sure which one they mean. So again, that CPT code is very, very important. And so I can also reflect that properly on their agreement. But again, like I mentioned, your CPT codes that require to verify the actual tests that we are wanting Castle to perform. Just so extremely important. Tests will then be reviewed with the lab to verify that we perform them. That's also very important, that we can actually do what we're going to say we're going to do. Charge fees for the requested test will then be reviewed if they are below our standard client fee charge, which is 15% below Georgia Medicare allowed amount. So I will tell you for 2017, our rate of reimbursement did go up slightly, but I am not adjusting the client fee charge. I'm keeping it as it was from the 2016 Medicare rate. So it was just, it would have changed it by, for instance, like 50 cents or possibly $1, but I kept it lower. So actuality right now, our client bill fee on average is probably between 18% and the 15% below Medicare rate. So once the test and fees have been approved, a separate Castle Medical document will be created. It will need to be signed by the client along with the standard client bill fee-for-service agreement. That needs to then be sent back to client bill at castlemedical.com, and then the client can actually start sending samples. It's really super important that everyone understands that if you have a client that wants to do blood and chemistry especially, but tox is also included in this, is that the contracts are all sent to client bill prior to them sending those samples. There are steps that need to be taken in our software to set it up properly per test. So then when those samples start coming in, that the invoice is generated in a timely manner, which is in 1 week of those samples coming in. If they started sending in samples prior to the system being set up, there's a lot of back-end stuff that needs to go back to and reflected and changed to be able to present that invoice. So it just is very, very important. As soon as you have a client sign that client bill or fee-for-service agreement, that is being sent over to Castle Medical, again at client bill at castlemedical.com as soon as possible. Again, it's going to keep the client extremely happy that they're not going to have an incorrect invoice or anything like that. So it's really important that we all work together on that situation. Moving forward, how to fill out a client bill contract. if any of you have ever seen a client bill contract, you'd know looking at this that it didn't used to look like this. I have adjusted it. That's why it's really important that you use the one that's currently online in the portal now moving forward. So it should look just like this, and it's newly updated. I updated it on January 11th. And this single contract can be utilized for all of our testing now. We do still have a DNA one up there, which you can still utilize, but the terminology is the same. And here, if you've noticed at the very close to the bottom of the contract on the first page, the pricing now reflects everything: screens, confirms, different whatever the panel might be, the chemistry tests, and molecular diagnostic infectious disease tests, which reflects that attachment that I just talked about on the previous slide. So again, very much in bold at the bottom on the first page, client shall be responsible for all Castle fees regardless of amount actually collected by client. Very important that they understand that. So again, this is a client bill agreement, not a fee-for-service agreement. I do not have examples of the fee-for-service agreement, but this one is geared toward pricing of and regulations of them billing insurances, so on and so forth. So I would encourage everyone to review both contracts that are on the portal, the client bill as well as the fee-for-service, so you have a complete understanding of the differences of those programs and also what you're asking the client to sign. So here on the first page, we have the date. Again, this is just the date of the contract was signed. That is not an effective date of this agreement, just to let you know that. The clinic or facility name and address can be then placed at the top. Type of service being client billed, that's below that, directly below the thank you for selecting Castle Medical. And the term, there's the term date of the effective date. That's the date that this is going to go into effect. We never want to post or predate this. Well, you can predate it, that's fine, but not post. For instance, today is January 27th. We do not want to create a contract. This is January 1st. Then that goes right back to that we have to go back to all the samples in that time frame and adjust them in our system. We always want to, it's today or moving forward as a term date that we want to utilize. If they wanted to do that previously, we need to make sure that we're working with that client to make sure that we're in there having that contract signed prior to their effective date that they want to start doing this process. Pricing per type of service is right below that. For instance, the chemistry, molecular diagnostic, and infectious disease, you won't have a physical price there simply because you will have the attachment. They can simply just indicate by an X that this is on the attachment that outlines their pricing. And note that clients shall be responsible for all Castle fees regardless of the amount actually collected by the client, which is already discussed, which is in the highlighted area of that first page. Moving on, the second page, very important section is invoicing and payment. The client has two options. Client shall pay each invoice in full within 30 days of receipt. They can mark that, or that they can mark the client may authorize automatic direct payments in full to Castle via ACH. Those are their two options that they have. They pay it in full with a check or over the phone. We can take their payment over the phone within 30 days of that invoice, or we can automatically take it out. We need those payments on a regular basis to keep the contract accurate and up to date and in full compliance. It also is down below. I'm just quickly looking at the contract. I believe that it is, maybe it's on the next page. Let me see where it is. It is regarding billing government plans, that it is not, it's against actually, you could say the law that the laboratory themselves needs to pay, or excuse me, needs to bill a patient's government plan for laboratory services. That's definitely a requirement, so that they follow that. And that goes along with even TRICARE. TRICARE is considered a government plan that Castle Medical must pay, even if they're in a client bill agreement situation. TRICARE is one that we need to bill. Again, a United Healthcare government plan, that would have to be us, even though United Healthcare to them just screams commercial, but it's not. Again, they could have government plans under UHC. Same thing with Blue Cross Blue Shield. There is government Blue Cross Blue Shield programs, not just straight commercial. That's where that strong biller needs to come into play when it comes to client bill. They need to be able to know those different insurances. Extremely important. I believe this is actually on the 4th or 5th page. The witnessing needs to be signed here. The client needs to place the client's name, the signature, print their name and date of that signature. The individuals on the castle end that should be signing this is Scott Damron or Jennifer Blair. They can, once we get the contract here, they can sign it. If the client would like a copy, then we can get them back a copy. So, but that's on that particular page of signage. Definitely must have the client sign on this particular page so they agree to the terms of this agreement. Next page is the ACH. So if they did mark to have an ACH, the payment's automatically withdrawn from their account. We need to have this entire document filled out, the list of financial institute, address of financial institute, authorized signature with title and date, authorized person's name printed, authorized person's address printed. Again, we need to be able to read this. Most importantly, to be honest, is the financial institute routing number and checking savings account number. We need to be able to read that on these ACHs. If we cannot read it, there's a good chance that there'll be some back and forth between us and you and possibly the client, and could cause a hiccup. So it's really important that that is printed on there so we can read it in very, very strong clarity. So payments will be withdrawn from the patient's account 7 to 10 days after the client receives an invoice. So it's really important that they know this. I believe March Jan currently only does it one time a month. I'm going to verify that, but I apologize I didn't have that information beforehand. But it's really important that they understand that once the invoice is created, that between 7 and let's just say 30 days, that payment will be coming out of their account that they've given us approval for by signing this ACH. And the last page that we have on here is a guarantee of payment. That it's filled. They read it. Number one, they are guaranteeing that they are going to follow the contract and they're going to pay us appropriately. So again, very important that they must sign this and agree to that terms. So a couple additional, just as a quick reminder, again, contracts must be turned in immediately. The TM sends signed contract to clientbill@castlemedical.com, and client bill agrees. Do not go to lab support. They do not, any contracts do not go to lab support@castlemedical.com. They all come to client bill, and please do not alter any of the client bill contracts. I have seen multiple contracts come in over the years that are just completely adjusted, and the purpose of the contract is these are the lawful agreements that we need to follow. If there's something the client does not like, then we need to contact myself, and I can contact any additional entities here at Castle to get that approved. But again, it's like, for instance, they cannot adjust to their billing. They can only bill commercials. They cannot say they want to bill government. That's not going to be okay. Invoicing, they will always be invoiced every week. We cannot adjust that either. Some clients want to be billed every month. That's not permitted. It's every week. So there are certain things, many things are just set in stone. But if a client is very persistent that they want something adjusted, you can always contact me or Jennifer Blair. We can review it, but we cannot guarantee any adjustments being conducted on that contract. Any questions regarding the contract? Okay. Yes, go ahead, Ron.
On the fee-for-service versus bill for client bill, is there a difference in the time frame that we can actually bill the provider?
No, the time frame that is exactly the same. It is every week we will bill that client for fee-for-service. The process is the same on our end when it comes to billing. So regardless of if it is a client bill or if it's fee-for-service, we will bill that out every single week.
Okay, because I've got one that I thought was set up for every month because she gets paid by the state once a month. But whenever I get my email fixed, I'll email you and we can talk about it and look at the account. change anything.
Okay. The one thing about that, I mean, they can still pay in 30 days, but the invoices are still being sent out every week.
Okay, that might be what she's doing then. That'll be fine.
That's probably it. Yeah.
Okay.
So
thank you.
You're welcome. So here, how to fill out a requisition. I know you guys probably already know this, but I want to go over it anyway. That we need to have the requesting physician. If we don't have that, then again, it's considered a TIQ. The patient's full name as it appears on the insurance card. That's really super important. And these are guidelines regardless if we're billing or they're billing. So just to make that clear, we need that information. The date of birth of the patient, we need that. If we don't, it's considered a TIQ, a testing question. All three of those items at the very top that I just mentioned, requesting physician, patient's full name as it appears on the insurance card, the date of birth, and I'm going to go ahead and throw in the requested test panel marked. Those four things, if they are not there, we cannot run the test. It will then be basically refrigerated and we won't run anything until we have those elements. It's a dead test until we get those. But for billing purposes, for us, we cannot bill it if we don't have the patient's name, patient's address, city, and zip, insurance card information. Obviously, we cannot do that. Diagnosis code, we cannot bill at all without the diagnosis code. But the biggest thing on here is, again, reflection of the bill type, that we have those three options again, insurance, self-pay, client bill, that those need to be marked, and they need to be marked correctly. And that's where, again, if it's a client bill client or a fee-for-service client, that they're understanding what they're marking. And if they are taking responsibility to pay Castle for the service, then it should be marked client bill. If they want Castle to bill the patient's insurance, it should be marked insurance. If they want Castle Medical to bill the patients directly, it should be marked self-pay. Very important. Those guidelines are followed. On all government plans, which include TRICARE, are to be billed through Castle Medical. These types of requisitions would be marked as insurance. So again, always be very familiar how to fill out a requisition. I do know there's many very busy offices out there that they try to take shortcuts and not follow proper processes, but it's really important that all this information is shared with us. If they use online ordering, lots of these issues are just, they're not valid any longer because the online ordering requires them to fill it out before they can actually submit the order. So it's always a good thing to have any client, if possible, do online ordering. So again, I just wanted to review one more time. Insurance, if it's marked, means that Castle is going to be billing the patient's insurance. Client bill means that the client will be, in this case for client bill, would be receiving insurance reimbursement from the patient's insurance, but also, again, maybe if they're fee-for-service, they're still going to be marking client bill that they're receiving their funds from the patient. But again, they're going to be receiving an invoice from us. And self-pay, Castle is billing the patient. Okay. Moving forward, invoicing, client bill, fee-for-service invoicing. This is what Rodney and I were just talking about. The goal in the following process is to process an invoice that will be sent to our client bill and fee-for-service clients that reflects all their specimens that were marked client bill and collected in their office during the billing cycle. Again, that billing cycle is by week, so it is Sunday to Saturday. So for instance, this week, possibly even today, I'm unsure what days of the week they actually do it. They have billed out specimens from last week, which was the 15th through the 21st. So all specimens that were collected in a session during that time frame, marked client bill, will be in an invoice that were sent out this week. Okay. I did hear actually that they're no longer doing statements. I apologize, I'm not up to speed on exactly what's going on with that. Lisa Mitchell is the primary client bill and fee-for-service representative here at Castle. So if you have any clients that have a fee-for-service or client bill, you can definitely reach out to her. I'm also going to find out for me, so then I can get that information for future knowledge. And courtesy calls, I heard they're not doing that either. I guess those were attempted when Portia was still here with us, but was just not a good process that was working out, so they've actually stopped those courtesy calls. Moving forward, reviewing invoices. All of you have the option to review your client's invoices online. I'm hopeful that everyone knew that. To do this, again, very simple steps to make this happen. You're going to go to our website, click on the login at the top right of the page in the blue bar, enter the username and password that has been assigned to the client / yourself, the TM, the username and password. They are case sensitive, so please be aware of that. Within the menu option that are available along the left side of the screen, select Account Statement Invoice, and that's the image that's reflecting here. You want to click on that Account Statement Invoice section. And once it's selected, the screen will display all the client's invoices, the date of the invoice, the amount of the invoice, total paid, total adjusted, and balance. Large thing to remember about this is that if a patient, or excuse me, I always say patient, once a client has paid off an invoice, that invoice will disappear from this portal. You will not see it. So this is where it's important. If you have a client bill or fee-for-service client, that you are aware of their balance and their invoices. So when you go in there again and you see that something has changed, then you know they've paid it off. We cannot adjust this section of the portal. It is just how it is. We would love for you to see all of their payments and all the invoices that those payments were applied to, but Comtron doesn't work that way. It just simply will only reflect open invoices and not anything that's been paid off. But if it's a partial payment, it's still listed there. If there's been adjustments, let me describe an adjustment. It could be that the client has contacted us and said that they marked the requisition incorrectly, that they didn't actually bill it, that they want us to bill it. Then we will bill it and take it off their invoice. It will reflect as an adjustment. Or possibly that they had a negotiation of a fee change, and that if we've adjusted their fee on their invoice, it will reflect again in that section as an adjustment. But if that invoice is open with any balance on it, it will reflect in that section and reflect those items. You can click on it. You can download the full invoice with patient details to give to the patient or even for your own review. So it does give good information. It doesn't give full information. So, but please, if you have any client bill or fee-for-service clients, log on there, click on that section, and take a look at your client's information. Very, very valuable. Okay. Also, yeah, go ahead.
Quick question. Is there any place that we can see our delinquent accounts and if the people are paying on their delinquent bill?
Your delinquents, you're asking, can you see their payments on delinquent accounts?
Yeah. Well, is there a place that we can go look at our delinquent accounts and see if they're making their payments without us having to call CASA to find out?
The only way to do that is if you know, obviously, who your delinquent accounts are, and you go into this section of the portal, and you're familiar with their balance and their invoices. And if anything changes, then you're going to see that they've made a payment. But other than that, you need to contact Lisa to find out what the activity is on their account.
Okay.
Okay?
Yeah, thank you.
You're welcome. So, but like step number 5 here actually says all this information is real-time information that is generated right out of Castle Medical's LabGen software. So as soon as a payment's posted on an invoice, as long as the invoice isn't paid off, it'll reflect here in your portal. Or again, as soon as they create an invoice, it'll reflect here in your portal. Okay. Delinquent client bill fee-for-service accounts. An account is considered delinquent once a 90-day period has passed without a payment from the client. An account will stay delinquent until the account is paid in full or has a payment plan to be paid in full. So this is, again, very important that that the client is following the agreement, that they are understanding that they need to pay in a timely manner. We do give that lag of 90 days. But once they hit 90 days, they will go on a delinquency report, and this is when your commissions actually stop on your client bill specimens. Not on the full account, just on the client bill specimens, that you will not get reimbursement for those. But once the account, and on down, once an account can no longer be settled to a non-delinquency status, the account will be sent to collections. And normally our regular outline of those types of clients is if you, the TM, has just exhausted all possibility of settling to have them make their payments, that it just can't be, made an arrangement for, we will send them on to a collection agency. But I also wanted to outline here delinquency accounts and commission reimbursement, because there are situations where a client does make some payments, even though they have exceeded that 90 days, that have put them on delinquency, but they still might be sending payments. How does that affect your commission? Number one, this is in the messenger under client bill, the billing and client bill section, so you can see this at any given time, and there's multiple options. Number one, non-payment delinquent status. That means the TM, you're not going to get payments on their sample accounts for client bill at all. But if they've made a partial payment, clients make a partial payment, the payment does not qualify for a payment arrangement, you will get a portion of what that partial payment is reflecting. And I do have an example here. Client fee, except for maybe $100, the client pays $1,000. That would be then reflected of 10 client bill specimens. You're going to get paid on those 10, as an example. And that goes on. It's the basic logic through all these options. A payment arrangement, 25% of the balance in 4-month payment plans. Again, once those payments are received, once they are received, then you're going to get that same example of the partial payment. It's going to be broken out into samples that is going to be paid out to you once those payments are received. If the credit card is on file, client gives counsel a credit card on file along with a payment plan that fits their financial budget and a day on which they would like to the payment to be withdrawn to bring the account up to current. Each payment received will be calculated and paid to the TM that reflects the appropriate number of client bill fee-for-service specimens the payment covers, exactly like my example in partial payment. It's also my example at the bottom as well. So that goes all the way through. If they've made a payment on their client bill or fee-for-service account, you will get payment, you'll get reimbursed for that amount that they've paid on. The settlement, yes, if they might need to settle, then yes, you're going to get commissions on what was settled upon, but possibly not the full balance. So it's good to understand that. We definitely want them to be on a payment plan or do a credit card or partial payment, so then you can get, again, the best possible reimbursement. Okay? Any questions about anything that's been discussed? All right. Well, again, if you think of something later on, please feel free to contact me, and I can get your answer to you as quickly as possible. And I just want to thank everybody for taking a quick moment out of your busy Friday to join me, and have a wonderful day. Thank you so much.
Thank you.